This celebration in the White House Rose Garden to honor the president's pick for Supreme Court nominee is being given a new, harsh label by the country's top infectious disease expert.
We had a super spreader event in the White House, and it was in a situation where people were crowded together and were not wearing masks.
The world will find out tomorrow whether any lessons have been learned and physical distancing will be enforced, as Donald Trump is set to deliver his first public remarks here since his COVID diagnosis.
I feel better now than I did 2 weeks ago. It's crazy. And I recovered immediately, almost immediately. I might not have recovered at all.
Trump's doctor says it is safe for him to resume public engagements as of Saturday, as 10 days will have passed since first testing positive. On Monday, he will travel to Florida for a rally, though some question whether any of this is safe.
From the information that we have, had moderate to severe COVID viral infection. And for those patients, if you look at the CDC guidelines, they could be contagious for up to 20 days.
His reckless personal conduct since his diagnosis, the destabilizing effect it's having on our government, is unconscionable.
The president's doctors have released few specifics about his illness, and no officials will confirm when the president last tested negative, leaving questions as to whether Trump skirted testing rules ahead of last week's debate.
Did the president at least comply with the Cleveland Clinic debate requirements to be negative tested in the 72 hours prior to that debate? Was that
you are
was the
very
president in
focused on
compliance with
looking
that?
backwards.
Now, Katie, the president is trying to assure voters that he is, in fact, healthy and agreed to be examined by a doctor for a reality TV special. What happened?
It was more of an interview, Ian, than it was originally billed, and the president went into more detail about his experience with COVID, explaining how he felt when he was admitted to hospital.
I think didn't feel strong, didn't feel really strong. I didn't have a problem with breathing, which a lot of people seem to have. I had none of that. But I didn't feel very strong. I didn't feel very vital.
It is worth pointing out, Ian, that Donald Trump did require supplemental oxygen to assist with his breathing. The president was asked if there are any lessons to be learned here, anything the public can take away about preventing the spread of COVID. Trump focused on his own personal case, saying his recovery is because of his early access to medicine. He did not make any pitch for physical distancing. He also says he's still waiting for the results of his latest COVID test. Even though the results are not in, his campaign is pushing ahead with his speech tomorrow and a rally on Monday.
Just think, it was just a week ago he went by helicopter to hospital. Katie Simpson, thank you.
Thanks.